critics warn it's wrong to overpromise unproven treatments like hydroxychloroquine, which has been touted by President Trump. Ilana drove her husband to this hospital emergency room in New Jersey. She wasn't allowed to go in, and she hasn't seen him since. That was 3 weeks ago. Not getting any better, doctors told her his only hope was an experimental drug called remdesivir. At the time, Gilead, the manufacturer, said Michael didn't qualify, partly because he'd been on a ventilator too long.
I couldn't understand why in America, in our life today, we have to be calling people and begging for medicine.
Remdesivir is one of 10 potential coronavirus treatments in clinical trials right now. Another 15 are in development. But with thousands of families desperate for a miracle cure, doctors say deciding who gets an experimental drug is difficult.
The really trickiest triage part, we have to decide who has the best chance of getting out of the hospital alive if they're on the ventilator.
And critics warn it's wrong to overpromise unproven treatments like hydroxychloroquine, which has been touted by President Trump.
In a very small but real number of patients, these drugs could upset the heart's electrical system and even cause the patient's sudden death.
A study expected this week will reveal whether remdesivir is safe and effective, and Gilead has ramped up production to give access to more desperate patients.
All right, your questions as always, and Dr. Jen Ashton back tonight. And Jen, hope today for a potential new treatment?
Exactly, David. It's a drug called EIDD-2801. It's a pill that blocks the coronavirus from attaching to lung cells in test tubes. It could be used to both treat and prevent COVID-19, and it is set to start clinical trials in humans this spring.
Not a moment too soon.
Critics warn it's wrong to overpromise unproven treatments like hydroxychloroquine, which has been touted by President Trump.